Hi everyone, it's Louise Pearson and I'm back now to do a video for you on Whipple surgery, which is one of the treatments that I had for pancreatic cancer. So I know it's not necessarily for everyone because this is my series on when you're the one with a life-limiting illness. But why I wanted to do this video for you was because although I've since been able to find some great articles and resources about Whipple, and some of them I'll include for you as links from places like the MD Anderson Cancer Center in the US or Johns Hopkins, I found that there was very little information for me about what Whipple was, what it was like as someone who was going to experiencing it. So they tell you to weigh up your options and to know about the risks, but there's not always a lot of time. And there was I, alone in Melbourne's Austin Hospital, knowing that this tumour was growing inside of me, but worried about what the Whipple would be like. So you're a candidate for Whipple, or you might have just had one as you read listen to this video. If this is you, I wanted to redress that little imbalance that I found and answer some of the things that I had need answers to then with some first-hand experiences. Remember, I'm not an expert. I'm just a survivor of Whipple. And so to give you a brief explanation, my understanding of what Whipple is that it's the main surgical option open to people with pancreatic cancer. It can be used for other cancers, cancer of the duodenum or of the bile ducts, for example, and sometimes it can be used where there isn't any cancer. But Johns Hopkins general information tells us that the Whipple procedure, also called a pancreatic duodenectomy, is the primary surgical treatment for pancreatic cancer that occurs within the head of the gland. And during this procedure, surgeons remove the head of the pancreas, most of the duodenum, which is a part of the small intestine, a portion of the bile duct, the gallbladder, and associated lymph nodes. In some cases, the surgeon may remove the body of the pancreas, the entire duodenum, and some of the stomach. On average, the surgery takes 6 hours to complete. So most patients will stay in the hospital for 1 to 2 weeks, and for me, it was 2 weeks following the Whipple procedure. What I've come to discover afterwards is that sometimes it's done after a bout of chemotherapy, and sometimes it's done immediately. For me, it was immediate. But what that translated to for me was that whenever it's done, it has risks and it provokes anxiety. So just to share with you some of my thoughts going into the Whipple. I wanted the cancer out at any price. Get it out was what I said to the surgeons. I was struggling to understand the statistics, to know whether I would survive, and to process my diagnosis itself, because I actually was diagnosed with pancreatic cancer 5 days before my Whipple. So the warnings of complications were sounding pretty serious to me, but the alternative was unthinkable. I didn't want to give the cancer a chance to grow and to just treat it with chemotherapy when the survival rates that I had read were not encouraging. I was frightened that they would open me up and discover that it had progressed further when they got the human eye to it onto the scene. And so, I was really hoping that they could do the Whipple. But I also found it hard to picture what the actual Whipple looked like. One of the things, if you've been listening to my other videos, that you might know is that I'm a blind person. So yeah, I was giving them a little bit carte blanche because I wasn't sure what they were going to do. The road back looked scary, and so I prepared for the worst. I had my will updated, I did my enduring powers of attorney, I knew that my parents were going to move into my house to look after me when I came home because it is one of the biggest operations that is ever done. And so I was as prepared as I could be. When you wake up in intensive care, usually, the thirst is incredible. For me, so was also the fact that there was someone telling me the time, because although I was recovering, obviously, and in the early stages of recovering from one of the biggest anesthetics that I should imagine most people receive, I was aware of the time, and the time was that the operation had taken 8 hours, and therefore the Whipple had gone ahead. They had removed my tumour, or as much of it as they could. The pain, I have to tell you, is fairly incredible. I've never known anything like it. But here's a plus. Chemo, radiotherapy, they got nothing on Whipple. And as you can see, I'm sitting here, I'm telling you the story. It's fine. The pain in the beginning is awful. It got worse, not better, in the first day. And that is because they've given you so much at the time of the operation. I had had a spinal tap for the pain, or to knock me out, I guess. And so in the first few hours, I was better than I was after a day. I felt weak beyond belief. Any movement hurt, and the general idea is that you don't eat for 2 or 3 days. Great. So, the thirst was amazing. Know that, and know that you'll get through it. So's the pain. I was desperate for some reassurance. I'm not someone who falls apart easily, but it was one of those times in my life when I wanted someone to sweep into the scene, take hold of my hand and say, yes, I know this is scary, but you know what? You've so got this. You're on the road to recovery. And this time next week, you won't know yourself. You'll be feeling so much better. And that's my truth. Yep, my first bowel motion took a week. Not surprising when you consider that they've reconstructed my intestines. So just be assured in those first few days, walking is difficult. Going to the toilet is frightening because they've reconstructed your tummy. Everything is strange, and even the smallest movement can cause pain. But be assured, this too will pass. I'm 2 years and almost 1 month on from my Whipple. I call it, because someone taught me to on a Facebook group, my Whippleversary. I want to share with you that within 2 weeks, barring complications, you will feel so much better. Yes, you will need to wear loose clothes for a long time, and as a woman, putting on a bra can hurt because it sits on the scar. Strength returns slowly, I found, and it will make it hard to do things like housework and meal preparation. I remember being at home on my first morning and thinking, I can either unpack the dishwasher or make a coffee. I can't do both. So divide your tasks up. Turning over in bed is really difficult in the first few weeks, and I have to tell you that probably for the first few months after my Whipple surgery, I would wake up every hour. Use a pillow in your bed or 2 pillows. And if you're really needing to sleep and really struggling with it, maybe talk to your doctor about having some sleeping pills on hand, or look at herbal options, whatever it is for you. Standing for long periods can also be really difficult. But again, these things start to recede with time. Seek help with any issues that you have. So a dietitian would have been great for me then. I didn't have one on hand, but go and see one. As I said, get some sleeping tablets. Look around for support that's available to you. Here in Australia, I joined a Facebook group called Whipple's Warriors Australia. And, people were there for me to ask questions of. In my first couple of nights at home, someone wrote that they were celebrating their 20-year Whippleversary. That was such a great moment for me. And the most important thing I can say to you is persist. For me, it has paid off. I was back to work part-time within 4 weeks and full-time within 4 months. I took a long time for appetite to come back, but now they're going to call me up for the team to eat for Australia. Sometimes the cancer interrupts that. Sometimes I'll have some problems because of chemotherapy or of radiotherapy, but I don't really think anymore that it's the Whipple. The scar is barely visible, and it certainly isn't sore. I can now wear tight jeans again. I can lift heavy objects. I can swim 5 kilometres if I want to. And at the time, I doubted I'd get there. So that's why I wanted to share this video with you if you're anywhere on the Whipple journey. So keep watching for more videos. Press like and subscribe if you found this helpful. And I'll be back to talk to you soon about some of the other treatments that I've experienced with pancreatic cancer.